Hi guys, I'm Dr. Samantha Lieberman and I'm here in our surgical suite. Wanted to introduce to you the surgery suite where we'll be doing some spays and neuters and show you all the stuff that's around here. This is the surgery table where we put the patient, and of course they get tied to the table so that they don't move around. This is our anesthesia machine, which is what providing them the inhaled anesthesia that they need to be sleeping during the procedure, including oxygen tanks, of course. Over here we have our fluids, which are attached to a fluid pump, and those go IV into the patients when they're having surgery. And then lastly, this is our anesthesia monitoring equipment. So this is what we hook up to get an EKG and a pulse ox and watch their heart rate and heart rhythm while they're under anesthesia. A really important part of any surgical suite is the lighting that we have. So I'm trying to get around here to show you. We have some great lights. These will allow to focus directly onto the area where we're going to be doing surgery, because you have to be able to see what you're doing. It's not good to be in the dark. This right here is what we call a Mayo stand. This is where the instruments will go for surgery. We also have a kick bucket, which is exactly what it sounds like. You can kick it around, put it where it needs to go, so that you can get rid of all of your disposables when you're done with them. This surgery suite is really nice because it does have this big window here, so students can actually be outside of the surgery suite, not getting contaminated, not being unsterile, because in here we should be sterile, and they can be watching the procedure that way. There's also a camera, which is right here above, looking down onto the surgery table, so that other students can be outside monitoring us while we're doing surgery without actually being in this room as well. I was going to show you the adjacent room, but there are students in there, so we'll just peek through the window. In this room, this is our prep room. So this is where we would put on our gowns and gloves and get all the equipment together. It's also the autoclave there. That's where we will get the instruments clean and sterilized for the next time. One more thing I wanted to point out in the surgery suite, we do have a chart up here on the wall which lists all of our CPR and emergency drugs. That's a God forbid. You know, we certainly don't want that to happen, but if we ever needed to, the last thing we want to try and figure out in an emergency is what amount of drugs to be using for any given patient. So it's nice when it's right there on the wall. Anyway, I really look forward to doing surgery, and I hope you appreciated the little tour. When you come see it in person, it'll be much better. And again, I'm Dr. Lieberman, new doctor with the Vet Tech program here in Phoenix. Bye.